Nelson, I'm so glad to have you here. Yeah, Nelson Valena is joining us today. Dr. Nelson Valena, who we met about a year ago, maybe just a little bit longer than no, a year ago, probably this month,
Yes.
at your beautiful Golden Hill retreat, and we had a fun experience there, which we're not talking about today. But like it's so awesome to have you at Lily with us, and we want to hear all about your story and what you've got going on,
Mhm.
and about like how Golden Hill came into being, and like what's next for you and Jason there. So
Well, thank
tell
you.
me,
Yes,
tell
thank you
us.
for having me. I'm excited to be here because I know you've told me about it and haven't had a chance to make it over. But I always am excited when I hear about people starting centers to help people activate their inner healer.
Yeah.
Because truly that's what we all need to do
Mhm.
is really think about how can we help people facilitate their own healing instead of having to hand a pill
That's
or a
right.
procedure or something else to them. So thank you for doing this.
Absolutely.
Yes, I think as we share our stories, we all have some similarities
Yeah.
to how we got here, right? We all have a point in our lives where we are searching for something else. So the same story for me. I was born into medicine because my parents were both physicians.
Oh.
And so they actually started a clinic in the Philippines, and they developed this clinic for the service of the town called Calawag, which is a small seaside town. And so I was pretty much born into healthcare.
Oh
I
wow.
remember one of my first experiences is finding a amputated arm in a bathtub
Oh.
as a little kid.
Oh
Okay.
wow.
And, it was one of those things where, yeah, that wasn't a big deal. Or there was, my dad used to do some general surgery and
Yeah.
do mastectomies. There would be like jars of
Wow.
like breast tissue and
Mhm.
things. So, it was one of those things that, oh, okay, well, this is just,
It
an
wasn't creepy
everyday
for
kind of
you.
thing. Right.
Yeah,
Yeah.
it was
So,
like,
and a part of me
huh,
felt like, oh, okay, well, I think I'm going to follow his footsteps, right?
yeah,
Sure. Yeah.
yeah.
So
Sure.
that's exactly what happened. Is out of the six kids,
Yeah.
I'm the fourth one, but I was also the oldest son. Bit of pressure there
Sure.
A
Yeah.
for
little.
yes, for
Okay.
me to follow in the footsteps. So
Yeah.
I did my medical training and did the whole spiel about doing the fellowship, and then actually started at Baylor.
Mhm.
That's what brought me here to Houston,
Okay.
Okay.
was the training at Baylor
Mhm.
College of Medicine.
Yeah.
And it was specifically went into rehabilitation medicine,
Mhm.
which is, they call it physical medicine rehabilitation. And basically what it is a specialty that takes care of people with disabilities from injuries and illnesses.
Okay.
And furthermore, I did a fellowship in brain injury medicine, which
Oh,
is specifically looking at how do we help those who have undergone brain trauma or brain tumors,
Mhm.
and also with spinal cord injuries, so
okay.
neurological disorders.
Uh-huh.
So I did that for a while, and I was getting successful and very busy. And in 2011, my life changed, and it had to do with myself being a brain injury doctor developing a stroke.
Wow. Never saw that coming, did you?
No. So it was,
Okay.
but in hindsight, it's the best thing that ever happened to me.
It
Yeah.
usually works like that.
Exactly,
I can tell
right?
you.
And
Like,
like you
here we
said,
are.
Yeah.
and
Yeah.
I'm sure, you
Yeah.
can relate to this, is
Yeah.
these devastating, challenging things that happen in our life
Yeah.
are there for a reason. And it's for us to maybe direct us to where we're actually supposed to go.
Mhm.
Yeah.
So I always have this belief that these challenges, the suffering, even illnesses, are basically messages that we're out of alignment in some areas of our life,
Absolutely.
and that the challenge is to try to assess your life and where are you out of alignment, and then try to figure out how do I get myself back into that balance and homeostasis.
Yeah.
Yeah.
Love that.
Wow.
Yeah, that's exactly right. Because I know when I got sick, I know because I got sick because I wasn't living right. And that's why I got sick.
Right. But the good thing is you followed
Hmm.
and you listen.
Yep.
There's a lot of people that don't listen,
That's right.
Yeah.
and then they end up suffering, and
Yeah.
eventually they get sicker.
Yeah.
Yeah.
And then, and honestly, I think that's a challenge for most of the world. And we have a lot more people with chronic illnesses.
Hmm.
I mean, it's multiple factors in regards to our toxins in the environment, in our food, but also the overall stress that we're all facing,
Hmm.
everything that's going on in the world,
Yeah.
putting us in that fight flight response.
Right.
Yep.
We're all contributing to a sick world,
That's
you
right.
know.
We are.
Yeah, so we have to do what we can to try to help people get well. And
Yes.
thus,
Yeah.
like what you guys are doing and what we're doing at Golden Hill,
Yeah.
it's really needed now.
It is.
So when your life changed, when that script flipped for you, um, what were some of the things that you immediately changed in your life? Because I can only imagine how, and tell us how debilitated you were
Mm.
from that stroke.
Yeah, so
Walk us through all that.
Mhm.
fortunately, it was a mild stroke.
Yeah.
So basically, I had some weakness on my face. I had
Mhm.
some difficulty with my speech and my swallowing,
Mhm.
but I was still able to get around and, do my communication.
Mhm.
But, the main thing was not really the physical damage that it did, but more the psychological injury that I had.
Yeah.
Because after about, I would say 2 to 3 weeks, my symptoms got better. And, I was basically almost physically back to normal.
Mhm.
However, psychologically, I was not okay.
Yeah. What was happening there?
It really brought up a lot of, it made me reflect on what was going on with me internally.
Mm-hmm.
Because, of course, many of us know that if we don't deal with things internally, that somehow it manifests in our outward reality.
Mhm.
And many times it manifests in our bodies
Yeah.
Mhm.
and develops an illness and symptoms. So I think I'm the prime example of that is perhaps I was distracting myself and not really dealing with all the internal emotions that I needed to bring up and deal with.
Mhm.
Mhm.
So it really made me think about what is it that I have to heal, and it led me to this whole journey of exploration, which
Right.
has been a wonderful journey since
Mhm.
2011. It's
Yeah.
been 14 years
14
now,
years now, right?
but it wasn't and at times it wasn't a fun journey,
No.
and it was very excruciating and very anxiety provoking. But
Mhm.
I would never have changed it
Mhm.
because
What
it brought me to where I'm at now.
Mhm.
what were some of your early steps? Like if somebody is experiencing something that their body's failing and it could be a happiness quotient that they're missing, like what were some of the things that were helpful to you early on? Like the baby steps.
Yes. So the
Mhm.
biggest thing for me was finding time. So I think this most people can relate to this
Yeah.
is when we're in the regular track of automatic pilot, most of
Yeah.
us probably have to focus on our work and careers and making money.
Yeah.
So it's we get ourselves to the point where we're so busy,
Mhm.
and in terms of self-care, like
Mhm.
that's something
Yeah.
nice, but yeah, that's when I have time.
Yeah. Were you
So
like last on your list?
I was last on my list, but I would say I'm the typical physician,
Mhm.
because
Mhm.
I was type A, go getter, pushing, pushing, pushing all the
Mhm.
time. So,
Mhm.
yes, I would work out. I remember at that time when I had a stroke, I was in pretty good shape, and that's why it was sort of very shocking to me to think,
Mhm.
okay, I'm doing the right things. Why did I have this happen to me?
Mhm.
I wasn't overweight. I didn't have high blood pressure. I wasn't on any medications
Mhm.
or anything like that. But yeah, I was actually self medicating because, first of all, I was always tired,
Okay.
because I never got rest.
Right,
Mhm.
And
right.
I always pushed, and my hours were, I would start at 8 o'clock in the morning, would get home at 10 or 11 at night, and start over again.
Yeah.
But I would wake up early, I would go to the gym, work out for 2 hours, or I would go
Mhm.
to Memorial Park and I would
Yeah.
do 6 miles.
Mhm.
Yeah.
And then, so it's this constant go, 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 and push, push, push.
Did your body give you any other tells, like other signs that you just ignored and blew
Oh,
off?
totally ignored.
Okay.
And I
Really?
think this is typical for many of us, right?
Yeah, yeah.
We're taught to push and push and push. And
Yeah.
so what does that mean? Is totally being disconnected with our bodies.
For sure.
It's like, oh yeah, I'm tired, but what am I going to do? I'm going to take a 5-hour energy drink.
Yeah.
So I
Right.
take a 5-hour energy drink to get
Keep going.
keep
Yeah.
going, and then I take something to bring me down.
Mm-hmm.
Whether it's alcohol or at that time I was on sleeping medication because I could never sleep.
Mhm.
So actually I attributed my symptoms to my sleeping medications. I mean,
Oh, the stroke and everything.
yes, because I thought my sluggishness and my sort of having difficulty with my speech was a hangover from my sleeping medication. So in my mind, I rationalized it and said, "Oh, it's nothing. It's from my sleeping medication.
Mm-hmm.
It's going to wear off." But after 3 days of not
Mhm.
getting any better, I realized it wasn't just that.
It wasn't that.
Right. So I think many of us, and even doctors, right? We oftentimes rationalize things, and so we can ignore
Mhm.
our own
Sure.
symptoms.
Sure.
And truly, I mean, I should have known, right? Because I'm a stroke doctor.
Well, yeah,
Yeah.
I mean, like maybe, hopefully,
Yes, right.
right? I'm
But-
thinking.
But yet, there's something within.
You think about it differently, huh?
You think of it differently, and a part of you, your ego, does not want to admit that.
Mm-hmm.
And you want to push, and you're like, no, I can do it. I'm gonna, and that's always been sort of
Like power through,
right, power through.
man up,
Exactly.
whatever,
and,
right?
and
Sure.
I'm sure many people can relate to this. is
Yeah.
Yeah.
We're conditioned that way, especially in the Western world. We're conditioned to push and compete, and be the best that you can and do it. And it's all that concept of doing,
Yeah.
and we've never really taught the other way of self-care.
That's right.
Taking it
Yeah.
easier, and it's that being, right? And
Yeah.
Yeah.
truly, that was the biggest. I would say if there was one thing that was the biggest barrier, was that. Was I had to change that whole mindset.
So you awoke. You had an awakening.
Awakening of
Yeah.
doing nothing.
Yes.
Like the
It's-
stillness.
Yes, the
Yes.
stillness.
The power in the stillness.
Power of
Yes.
stillness.
Yes.
And that is one of the most challenging part to change if you've been this way,
Yeah.
all your
Yes.
life.
Yeah.
Yeah.
And it was so excruciating for me to be in stillness.
Sure.
I remember the first, it's interesting because when you're in that deep, dark hole and you're in deep depression, I was taking multiple antidepressants. I was on benzodiazepines. And so that really slowed me down, of course, and really muddled my thinking. But throughout the whole time, I never really told other people, other physicians or other clinicians what I was going through
You were
because
alone.
yeah, because it's a fine line, right?
Sure.
Because you don't want to tell people all of this, and then because as a physician you have to portray a certain amount of, you have to have it together,
Right.
you have to be the one who's taking care of all the problems.
Right.
So you don't really have an option to be vulnerable and tell everyone and share it with everyone, what your challenges are. So I'm really, I feel for my colleagues because I know that many are suffering.
Yeah.
And because there's really, everyone knows that it exists, but no one's talking about it. Yeah.
Wow.
So
Why is that? Why is it that we don't talk about it?
I think
Why do you think that is?
multiple factors, right?
Yeah.
I think in the Western society, there's what's seen as good is you're being a go-getter and a competitor, and you can withstand everything, you can muscle through everything, and especially for men, right?
Yeah. Like a champion.
Yeah, champion. We have to
Yes.
be a warrior.
Like
Yes.
man up.
yeah,
Yeah.
man
Get it
up. We
done.
have to do
Yeah.
all of this.
Don't
So
feel the feels.
exactly. So if you're
Yeah.
not, portraying that, you're not being that, then you're considered weak.
Yeah.
Yeah.
You're considered, not worthy, and so on. So I think there's a certain part of that, and then you're also, I think, in training, in medical training, you're conditioned to be a certain way. Like I said, one thing that you learn is to disconnect.
Yeah.
Disconnect from your body and disconnect with your emotion.
Yeah.
Because if you
Yeah.
consider what a normal training would be in terms of residency, medical school, and you're perhaps in residency, you're up for 36 hours and you don't have sleep, and you can't listen to your body because your body's saying you need to go to bed, you need to go to sleep,
Right.
but
But
yeah,
that's not allowed.
that's not allowed, and you're
Right.
in charge of people's lives.
Yeah.
Yeah.
And so what do? You turn off your body and you don't listen to your body and you just use your mind and your rational thinking and you push through it and you will things to happen.
Mhm.
So if you continue to do that and continue to do that, you imagine what happens in terms of your nervous system.
Yeah, right.
You just disconnect from your nervous system and
Yeah.
what it's telling you.
Can't heal.
You can't heal.
No.
So most of us are in that fight, flight, survival, trying to make it through the day, trying to see 50 patients a day and having all these stresses and having to take care of everybody's problems
Yeah.
because you're in charge of that. And,
Yeah.
and everybody expects you to do that. So if you're having difficulty, it's not really, you can't really show it. And it's hard to get help.
It's not allowed. It sounds like it's just not allowed.
It's not allowed.
Yeah.
And the other caveat to that is there are some things that, for example, they have something called peer review, or so what they do is they ask other doctors or other staff members, does so and so have any reason that they wouldn't be able to fulfill their duties, or they have any mental health challenges or whatnot? And so if a doctor knows about that, a lot of times, they may report it, and then you lose your license, or you can't practice.
Well, how unfair is that? Because you can't get the help you need.
You can't get the help
and
you
you're
need.
in a healing art.
Right.
Like, that makes no sense at all.
It doesn't make any
No.
sense.
And it doesn't respect a human.
And this is what is so interesting to me and sad to me at the same time, is that you expect the healthcare professionals, the doctors who are taking care of everyone, to have the same thing as everybody else, which is somebody to take care of them as well.
Yeah, right.
Sure.
And that somebody to worry about them and to look after their best interests. But yeah, I think as a society,
no,
that's
they
not
don't.
happening.
Right.
No.
You're
It's
right.
it's sort of swept under the rug. Continue to do that, and just deal with it.
Yeah.
Because even in this big medical center in Houston, it's the largest medical center in the world, right?
Right.
There are no programs that really address that, to help other physicians and healthcare practitioners to have an ability to have support and self-care.
That needs to change.
Yeah.
So you're probably on a mission to make that happen.
That's one of the things that I'm really
Yeah.
passionate about, is trying to
Yeah.
figure out how do we develop a platform where we can support healthcare professionals.
Right.
And currently I'm working with an organization called Physician Transformation Institute. And it's a new institute, it's a nonprofit, and the goal is to help decrease the rate of burnout in physicians and to provide support for them, as well as open up these doors and open up the minds and hearts of physicians to non-traditional ways of healing, like the spirituality, the energy, medicine, and all the things that you're doing here, and what we're trying to do at Golden Hill as well.
Well, I want to talk about that because I love all the things that you guys have going on there.
Yeah,
Like,
no,
that
what
was
you're
just like
doing
a
too.
really epic experience. Thank you. So tell us what you have.
Yes. So, being a physician, and I'm always trying to, my left brain is still kicking, right? Even though I'm exploring these things,
Right.
As a scientist or a healthcare provider, I always want to understand how it works and how does it interface with our bodies.
Yes.
And as clinicians, we're always told, oh, this thing is woo-woo. There's no evidence base in this or whatnot.
Yeah.
But what I've discovered in the last 14 years was there's a whole different way of healing, and sometimes it doesn't need evidence base, because there's a whole gamut of and options of things out there that are not necessarily, I would say, have the backing of evidence base and science. However, it has been found by many, many people over thousands of years of generations to be effective.
Yes.
And why is that? So just because currently at this time things cannot be measured doesn't mean that it doesn't work.
At this time, we don't have the tools or technology to measure it.
Correct.
Perhaps.
Perhaps.
Right.
So I always like to
Yeah.
see things from energy, right?
Right.
Tesla, Einstein, they talk
Right.
about energy and that the universe is about energy.
Only that.
Yes. So you have to look at energy in terms of the continuum. So you have the dense energy, and then you have, the less dense energy.
Sure.
So when you're thinking about science, evidence-based physics, physiology, all of that, it's a dense energy. It's the energy that you could feel that's here in our three-dimensional reality.
Yeah. Like you think this chair is solid.
Exactly. But
Yeah.
it's not really
It's
solid,
not.
right?
Yes.
And we all know that now.
Right.
From quantum physics
Mhm.
and the atoms, and we all know that much of what they say, about 95%, is
Yes.
space. And
Yes.
it's the vibration and the energy, and depending on the frequency of the vibration will determine the density of it.
Right.
So the lower density or the higher density, the lower the vibration and
Yeah.
frequency. So that's this one.
Yeah.
But as you go up into the higher frequency, it is not as dense. And so you have a higher vibration. And truly that's where the spiritual and some of the energetic modalities that's where it all
That's
happens.
their domain.
Exactly.
Yes.
That's their domain.
Yes. Yes.
So what you can measure, the science, is the dense.
Yep.
Physics, and chemistry, biology, all of that is talking about the dense. And so when you talk about evidence-based, that's what you can, that's what they're talking about. That's what you can measure.
Yeah.
However, there's a whole 95%, right? That is the non-physical. And that's where we talk about spirituality. And that's where also the concepts of thought, consciousness, and emotions are. Can you truly measure those things? Not really.
Not really.
Perhaps emotions and feelings is sort of the interface there. Because, of course, with emotions, you have feelings, and the feelings you can feel in your body because of our neuropeptides and all the enzymes and all of the processes that make us feel a certain way.
And the chemistry.
And the chemistry. So,
project. Yeah.
Yeah, so that's how it's all interrelated. And one of the things when you start talking about some of these non-traditional modes of healing is this concept of psychoneuroimmunoendocrinology.
Okay.
Whoa.
Yeah.
Okay, I'm gonna have to write that
Say
down.
that again.
Yeah. So one of the things that is helpful for me is to talk in a language where other clinicians would understand how it is. And truly, this word, psychoneuroimmunoendocrinology.
Okay.
Endocrinology. Okay. Yeah.
And it's actually another one, psychoneuroimmunoendocrinology.
Okay.
Okay, meaning that psycho, meaning our thoughts, our mental states, okay, will influence our immunology, endocrinology, and our neurology, our nervous system.
Absolutely.
Right? So it's all the teachings of all of these big gurus like Dr. Dispenza and Bruce Lipton and Greg Braden. They all talk about how our emotions and thoughts influence our reality in our physical bodies. So a lot of these ancient traditions knew that.
They did.
And they considered whatever they're doing to incorporate that. So one of the things that I was very interested in, drawn to initially during my exploration was shamanism.
Okay.
Yeah, and somehow, and then I've already also changed my views on perhaps this whole thing about past lives and this whole thing in our souls. Because when you start diving into it, it opens up all these doors. And as long as you're open-minded, open-hearted, you get introduced to a lot of these ancient traditions that at first you think, is there something to it? But the key factor is when you start doing these things, you may not understand it, but what happens is you feel it.
Absolutely.
It's that knowing.
Yep.
And that knowing is what's helpful that leads to the transformation.
Mm.
Yeah.
So I think that's one of the big messages for many clinicians and healthcare practitioners is
Yeah.
I think it's important for us to acknowledge that our brains and our rational thinking is key to our health and well-being,
Mhm.
but this other aspect of being connected with our senses, our bodies, and that acknowledging that importance of intuition
Mm.
and our subtle awareness of what our bodies are telling us
Mhm.
is going to be the key for the transformation.
Mm.
And
Absolutely.
I'm sure you guys have experienced that here.
Yeah,
You know,
sure.
people doing the ice plunge, the
Yeah.
sauna, and
Yeah.
all these
Yeah.
other treatments. It's not like intellectually they may not understand it, but
Mhm.
they feel a difference.
You feel
Yeah.
it.
I tell Cindy too that you have to heal the spirit, the human spirit first before you heal the body. And the human spirit is the breath.
Yes.
And when you start people with the breath and then they do all these different modalities, it really leverages the healing and it heals. It really heals, you know. When you start with the
Yeah.
breath, you start the right way and you leverage the healing.
Yes.
Mm.
Yeah.
I love that. I mean, and you look at the spiritual traditions, right?
Mm-hmm.
And it is about inspiration, spirit.
Yes.
Yeah.
In the breath is the words spirit,
Right.
Yeah.
Yes. Respiration.
Yeah.
respiration, inspiration,
Yes.
all of
Yes.
that.
Yes.
So it's true.
Yes.
I've had some very interesting downloads and aha moments in
Mhm.
exploring these things and looking at. I'm a type that is always open-minded, and I love to see the whole gamut.
Yeah.
I'm not a black and white kind of guy,
Yeah.
and sometimes that gets in my head, and I
Uh-huh.
start exploring all these things, and I
Uh-huh.
get
Right. Right.
I'm sure
Sure,
you know what
yeah.
I'm
Yeah.
talking
do,
about.
Totally
yes.
know that.
However, I think the trick is to look at everything and then see the big patterns
Mhm.
of
Mhm.
what is the same in everything that you're seeing. And when you're able to do that from the bird's eye view,
Mhm.
that's when the truths come.
Mhm.
And one of the truths is exactly that,
Mhm.
is the power of the breath.
Yeah.
Whether it's the Wim Hof method,
Mhm.
whether it's the pranayama,
Mhm.
Mhm.
in the Vedic tradition.
Right.
Yeah, and you find it in many cultures. And
Yeah.
these past 14 years, I've done everything from Peruvian shamanism to exploring Chinese medicine,
Mhm.
to the Ayurvedic
Mhm.
traditions,
Yes.
Mhm.
and all of these things are talking about the same things,
Yeah.
Mhm.
but they have different terminologies for
Yes.
it.
And there's wisdom in all of it.
Right.
And it's a lost wisdom. And it's a remembering for me. Like when I tap into something, it doesn't feel foreign.
Mhm.
And I don't need scientific proof because I know what it does for me, how it heals me, how it feels inside of me.
Yes.
Mhm.
Yeah. And that's the magic.
Exactly.
And that tapping, it's like the healing isn't outside of us. Like you can't just give it, give your power to a physician or clinician or something else outside of you. I think it's everything that we need is inside. And yes, there are times that we need help, right?
Yes.
But the truth is within us.
Yes, and I
So
love that. I love that message, and I know you're probably familiar with Greg Braden's work.
I love Greg Graydon.
Yes,
Do you
and
know him?
I don't know him
I
personally.
want to meet him.
Yeah, that would
Like
be
he's
awesome.
actually, I've read his books over and
Yes,
over, and
I
let's make that happen.
yeah,
Okay,
I would love
okay. Are you
to.
hearing this, Greg Braden?
Yes.
We want to meet you.
No, because I mean, they're always my inspiration because they pull it together.
Yes,
They put
absolutely,
the sciences and the spirituality together.
absolutely.
But the main message that I love what he's always sharing with people is that yes, that divinity is within us.
We are God.
Right.
We
And
are.
it's to
Yes.
awaken that inner divinity
Yes.
is the answer to help us with the challenges we have in this world.
Yeah, it's coded in our DNA. The blueprint is there. We are
Right.
God having a human experience and a fractal of the divine. Yeah, I
Yes.
absolutely.
And it's interesting because it's sort of common knowledge that yes, this is the foundation of all of the
Mhm.
spiritual texts from eons.
Yeah.
Mhm.
Yeah.
And yet, when you start looking, it's interesting because when I did my integrative medicine fellowship,
Mhm.
after I slowed down and I basically stopped going to some of the hospitals in the medical center,
Mhm.
I started exploring, different trainings, and
Mhm.
one of the trainings I explored was shamanic training.
Sure.
Uh-huh.
So I actually did a 300-hour energy medicine course,
Wow.
and with Alberto Vialdo and Four Winds Society.
Okay.
And what their goal is to train Western clinicians on ancient Peruvian shamanism
Mhm.
and how that. And it's funny because early on when I was exploring, I was thinking, am I supposed to be a shaman? So
Yeah.
like maybe I was in my past
Yeah,
life, I was a
right.
shaman, and I'm
Well, you
supposed
might have
to.
been.
Yeah,
You
it's
probably
true.
were.
I probably
You
I
probably
do
were.
I do sense that that's
Yeah.
true.
Yeah.
That a
Mhm.
part of me, sometime in the ancient past
Yeah.
was doing this before.
Uh-huh.
But what I realized was, no, I'm not supposed to be a shaman. However, I'm supposed to understand
Yeah.
how it works and how it can help people. Because I truly feel like I found my mission, and my mission is to be that liaison
Yeah.
between
Bridge that gap.
traditional medicine and
Sure.
this whole
Mhm.
other world of the complementary medicine,
Mhm.
the holistic side of it. And truly, my goal and desire and my mission is to try to help integrate that
Yeah.
and to try to bring that into the mainstream. Is how do we all work together,
Mhm.
and how do we acknowledge that each part is important?
Yeah.
Mhm.
It's like science and spirit, right? The
Exactly.
cross section of that,
Mhm.
because there's room for both.
Yes.
There's wisdom in both.
Yes.
Yeah.
And the prophecies and people, many traditions have talked about this time when the science and the spirituality come together.
Mhm.
The Hopi prophecies talk about
Yes.
that in terms of the flying, the eagle and the condor flying together.
Yes.
And
The
then
time's now.
exactly the
It's
time
right
is now.
now.
It is.
And we're
Yeah.
part of that. And
Yeah.
We
the
are.
things that we're doing is to help people
We are.
understand and embody it.
We are. And I know, because that's what happened to us. Like, we didn't mean to do this. We totally didn't mean to do that. Like, we were happily, living our fast lives. And then Dion gets sick. Well, we fall in love, and then he gets sick, and then, our whole world changes. And he has a dream that we turn to something ancient to cure, and it did. And then when that happens, like with you, getting this started, like that kick started, this stroke kick started, this journey, when that happens, it changes the trajectory of your life.
Right.
Your life cannot be the same because it's too juicy not to share, right?
Right.
It's
And I'm sure you guys feel
right.
that way too.
Yeah.
That is my passion, is wherever I can, is to share as much as, through
Yeah.
these platforms of
Mhm.
Yeah.
podcasts or going to expos,
Yeah.
because I think we do have the responsibility to do that, but
Yeah.
because we were gifted with this
Absolutely.
experience and these opportunities,
Yeah.
that we have to share as much as we can.
And that's why we're here right now.
Yes.
Because these are these are tumultuous times. These are really scary times for a lot of people, and I think helping people get their nervous systems calm so that they can process and not get caught up in the chaos, and not lose our grounding or our footing, to because if you just breathe through this, these are the best times to be alive, and something so wonderful is on its way for us
Yes.
as humans, as humanity.
Exactly.
It-
I think we all have a choice on how we're going to perceive what's coming up.
we do.
And I think this has been talked about by the prophecies and many, many spiritual leaders, is that we as humans have the will, and we have a choice.
We do.
So we either face these things that are coming up as something to fear, or something that will eventually be of benefit in regards to bringing on something even better.
It's such a time of expansion.
Mhm.
Like it's very quantum. So by 2030, our world will not look the same.
Right.
So buckle up, right?
Buckle up.
Well, or ground. How about just ground?
Ground. But
Breathe.
exactly.
Yeah.
But I think it's so key that those of us that are in a position that can help with this transition,
Mhm.
that we fully step into it,
Mhm.
and not to be scared. Because what I found, and I don't know what you guys have found, is that once you step into your individual mission and purpose, the universe, God, the higher power is going to support you
Hmm.
in it.
Absolutely.
And these synchronicities will
Yeah.
come,
Yep.
the right
Yep.
connections will come.
Yeah.
Yep.
And, I'm amazed at what has happened in my life in the last 14 years.
Yeah.
I was there suicidal,
Yeah.
didn't want to live anymore. And then all of a sudden it led me to this. And yes, now I'm hopeful that, hey, I do have some purpose in my life. And perhaps it's going to be challenging, but
Hmm.
I would never trade it for anything else.
No way.
I can never imagine myself stepping back into my old life and doing what I was doing.
Yeah, the comforts of your old life, right? They just lost all interest. They lost
Hmm.
all attraction.
Right.
Yeah, I
And,
know.
and it's interesting too, because once you make that change, there's a lot of other changes, whether it's your social group or the
Hmm.
things that you're interested in, or even the things that come to you, right? It,
Yeah,
it just, it's a change in frequency and vibration. And
totally.
whatever that is, you will attract as well.
Hmm.
Yeah.
So it could be good or it could be bad. So some folks are staying in that lower frequency and they get all this suffering and everything is
Hmm.
hard.
Yeah.
Yeah.
But once you make the change and become aligned, then things change for you and you start getting these beautiful gifts
Yeah.
and these things that you could have never imagined.
Right.
Isn't it so great?
Yeah.
I know. I mean, like, I wake up in the morning with this
Mm.
thought of just surprise and delight me today. Like I have no idea what's going to happen
Yes.
because it will not be like yesterday, and who's going to show up. Like, us doing this with you today.
Yeah.
And what's next? Like, it's really so curious and all the synchronicities, which is, my favorite feeling,
Yeah.
right? When things just align and you're like, "Ah," it's just so great.
Yeah. And I love that. I love the fact, it's this whole concept of surrender.
Yeah.
Hmm.
Is that I think many of us, have this perspective that we have to make things happen, and we have to will it, and I've got to do this. What do I have to do next?
Yeah.
To do this, and this. But sometimes what you have to do is really be chill and still.
Is nothing.
Exactly, is receive,
Yeah.
because what I realize is a lot of times when we don't make that a priority in terms of having these periods of stillness, we miss out on all the messages. And it's
Yeah.
very subtle messages, and it's maybe something a gut feeling,
Yeah.
or something, heaviness in your chest or
Mhm.
or here, and it's interesting because over the years, I've I've, I've developed a sort of a communication with my body.
Right.
Hmm.
It's like,
Me too.
oh, okay,
Yeah.
that
Yeah.
little tingling in the back of my head
Yeah.
was telling me this,
Mm.
or oh yeah, that wheeziness, or it was telling me no, don't do that.
Right. And
Mhm.
trust
And
it.
trust it. And
Mhm.
Trust it.
yes, and
Yeah.
sometimes it's still hard to do that, right?
Mhm.
Yeah.
Because especially when we're in fear.
Sure.
Absolutely. Well, I want to have a whole nother Greg Braden conversation with you because
Yes.
I have learned so much from that man. I'm so
Mhm.
glad you vibe with him because we're going to meet him. We're going to figure out how to meet him.
Yes.
Uh, we must.
Well, I know he also has some private retreats and
Yeah.
different things like
And he
that.
lives in Santa Fe. I mean, I'm like stalker level on
Yeah.
him.
I know,
But
because I know you guys met Wim Hof.
we did.
Yeah.
We
Yeah, I
sure
would have
did.
loved to meet Wim
And you
Hof.
would. He is pure love. And what was so great about that was just because he was the one that when we got the bad news about Dion's leukemia, like
Mm.
we heard that news on a Thursday and they wanted to start treatment Monday. And that was we had like 3 days to just figure it out. And we were just so just
Had so much hope
cheerful.
in him,
Mm.
that he shared, and I'm so grateful to him for sharing
Yeah.
that
Yeah.
method to everybody. He really changed the world with change. I think that they kind of started the wellness movement with him getting that message out there to breathe that certain way.
Yeah.
Right.
And his story, like it was like the tragedy of his wife's suicide
Mm.
and being in a position where all he had was breath and cold, to because he had to keep moving forward.
Right.
And that's so hopeful. And we had to keep moving forward. And Dion's dream to take a cold bath would heal him. Like who knew, right?
Right. And that's
So
how spirit works.
that's how
Yeah.
spirit works, and the
It's a
courage to
strange. I
act
think
Hmm.
on
about it now.
spirit.
Yeah.
Yeah, and the courage to act, like to listen to that and act. And I'm so glad we did
Hmm.
because, this wouldn't have happened. So it was cool getting to think him and, to know him now.
Yeah.
Like we're not like
And
this frickin' brag, but we do know him.
Yeah.
right.
Yeah.
But I think once you start looking at these people that are sharing this information,
Yeah.
they're sort of you understand that this is being they're a vessel. Yeah,
Absolutely. And
that they have
yes.
been gifted with this particular type of healing or
Yes.
information, and they are responsible for sharing it with as many people as they can.
That's the point.
That's the way I feel too.
Yeah.
Right.
That because when I had the lymph nodes swollen in my neck, the size of golf balls and hurting so bad, I called the doctor. Doctor says, I say, doctor, what can I do to make it feel better? He says, Dion, you have lymphoma. There's nothing you can do. But I could. The cold water reduced the swelling. And mm, and I think that everybody with cancer or anything like that needs to know about this. And I want them to know that there is something they can do. They can heal themselves, uh, by themselves with themselves,
Right.
using this stuff.
I
Yeah.
love that. I love that message because one of
Yeah.
the things I've discovered too in this work and the holistic is that you have to empower the people to initiate and take responsibility for their
Mhm.
own health
Yeah.
Yeah.
instead of externalizing it and
Mhm.
Yeah.
waiting for a doctor or a
Yeah.
hospital to do this, and this.
Yes.
Yeah.
Because a lot of it is internal work.
Yeah.
Yeah.
And I learned
Right.
that the
Yes.
biggest way because I used to go and look at the doctors like they were going to save me, like they were saviors. But I found out after going to the oncologist and this and that, they weren't there for that.
Mm-mm.
And
Yeah.
and I had to relearn everything about my own self to heal myself. And it was remarkable. Because you look at them like a savior, like they're going to save your everything, and they're not for that,
Right.
really.
And that's a double-edged sword, right? Like what we were talking about in terms of our training. And I think a part of the training is that we're supposed to portray that,
Hmm.
right?
Sure.
That we are the hope and that
Hmm.
we are the healers and
Hmm.
so on. And so it's a double-edged sword
Hmm.
because when you have to portray that, then there's also expectations, right?
Hmm.
Yeah.
Yeah.
So I remember when I was busy at the hospital and I would be rounding, and there's so many regulations, and you have to follow these regulations in order to be paid, right?
Hmm.
The documentation, you have to write a specific diagnosis, you have to make sure that you do to check the boxes on which tests is being done,
Hmm.
you follow the algorithm and the protocols,
Hmm.
and if you don't, then you get penalized,
Wow.
that you don't get paid
Yeah.
Hmm.
or you get written up because you didn't follow the protocol
Mm-hmm.
and so on. And as a doctor, sometimes you feel trapped
Hmm.
because you have to follow these things. Otherwise, you're not going to get paid and
Right.
you're not going to be able to survive in your
Hmm.
practice and so on.
Right.
So, I want people to understand that doctors are not bad people,
Hmm.
that
Mm-hmm.
they are not this, and I've heard it in the spiritual community too.
Mm-hmm.
It's like, oh, healthcare, medicine, it's terrible. They all just want your money and all just want to push the drugs and all of that. It's not really like that. There's
Mm-mm.
always two sides, to the
Absolutely.
coin. Is
Yeah.
that we are also trying to do the best that we can, and I'd say for the most part, most
Yeah.
doctors are trying to do the best that they can,
Yeah.
that they want to help people and so on, but there's limitations and there's challenges on both sides.
Sure.
So it's just I would invite people is to really have the compassion
Hmm.
to understand that yes, there are challenges,
Mm-hmm.
and yeah, it might not be the best thing, and they're trying to do what they can, but not to just put the blame on everybody and just the
Yeah.
other person.
Yeah.
Yeah.
But also, I would encourage people to take responsibility.
Yes. Yeah.
One of the things that has always been interesting to me was in situations where I would see a patient and they basically come to me and like, "What are you gonna do, doc?"
Yeah, right.
Yeah, like, "What
Like
are you
you
gonna
have
do to
to fix
fix
it.
me?
Yeah.
What are
I've
you
been
gonna do?"
abusing my body for the
Right,
last 40 years.
Yeah.
What are you
exactly,
going to do right now?
exactly,
Yeah.
Yeah,
and I
yeah,
would get that a
Yeah.
lot.
A
Like,
lot of people have
wow.
that mindset.
right,
Yeah,
like, "What are you gonna do? What are you gonna give me?" You know, and if you don't give them anything, they're like, "You didn't do anything."
Yeah.
So there's a certain pressure where like, okay, people are gonna ask, "Give me an antibiotic,"
Hmm.
you know, "Give me a pain pill," you know, "Give me this, give me this, give me
yeah,
this." I've researched it on Google. This is what I need,
Hmm.
you know. So the doctor's there, like,
Yeah.
okay, you know, what
yeah.
is it? And if you don't give them what they need, sometimes they're not happy.
Not happy.
Yeah.
Plus, you're seeing 50 patients a day. That's insanity.
Right,
You can't have a relationship. You can't really know more like what's below the surface, which matters greatly that we now,
right.
we all know.
Exactly, and
Yeah.
it's interesting because I'm actually leading some discussions with healthcare professionals
Hmm.
and some of the challenges that we're having, and I was leading a discussion on morality and ethics. And you know, it's one of these things that in medical school and even in when you're in practice, it's you hear about it when something happens in the hospital,
Right,
you
right.
know, but it's something that we deal with every day, you know, and it's always this moral conflict. And there was this term that I began to understand, and it's moral injury, meaning that in healthcare, and I think a lot of clinicians and doctors can relate to this, is that we have to, like I said, we have to follow certain regulations to get paid or not to
Hmm.
be penalized or,
Hmm.
you know, put to the board or whatnot. But certainly some of those things we know inside may not be the
Oh,
best thing.
it's got to be soul
It is, and
gutting.
so there's like this friction within, like
Sure.
what they call cognitive dissonance. Like,
Oh, absolutely.
okay, I have to write this and I have to do this, but I know inside it's not
It's not
really
right.
not it's not
Mm.
right. It's
Right.
not the best
Hmm.
thing, but
Hmm.
I'm sort of
Like you feel
forced.
trapped.
Yeah, I
Yeah.
feel trapped.
Yeah.
I'm sort of forced to do this. So for the most part, people just give in and do it,
Do it. Yeah.
you know. But over time, what
Yeah.
happens is that it builds up, right?
Yeah.
This feeling like, this isn't quite right,
Hmm.
but what am I going to do?
Hmm.
And to me, I honestly feel like that was part of the reason why I had the stroke,
Yeah.
was
Wow.
that over time, I began to realize, oh my gosh, you know, what are we truly doing here? And
Yeah.
basically, I'm looking and I'm rounding, and my choices are I'm going to write another prescription,
Yeah.
or I'm going to write for another test or procedure.
Hmm.
And truly, is that really helping the person that I'm working with?
Hmm.
Or maybe it's alleviating some of the symptoms and just sort of putting a band aid on it.
Hmm.
But truly, am I taking care of the problem, the root cause?
Hmm.
Because, especially what I do with rehabilitation, and
Yeah.
when I was working at the medical center, I was working at what they call an LTAC, long term acute care facility.
Okay.
And it's a type of facility that people go to when they're really sick,
Hmm.
when they're in the hospital, say they're at Methodist Hospital,
Hmm.
and they take care and stabilize them,
Hmm.
but they're so sick that they really can't go anywhere else.
Okay.
They still need ongoing care, and they're there for months and months,
Wow.
right? So I
Right.
would follow them months and months and months,
Wow.
and you see them, and they may get better for a little while, but sure enough, the patient gets discharged. 2 months later, they're back.
Mm.
And you see this over
Over and
and over
over.
and over
Wow.
again. And you think, oh my gosh, you know, how many times are we actually going to do
We can
this?
do this.
Yeah.
Yeah.
Right. And just continue and
Yeah.
continue. And then you get to realize, is what we're doing really taking care of the root cause? Or are we just sort of giving a band-aid
Like
and trying to
waxing over it.
stabilize them?
Yeah.
And then they go home, and then they end up coming back for the same reasons.
Yeah.
Mm.
You know, so your mind starts thinking, there's something off about this.
Like I'm not doing good work.
Yeah, and exactly,
I'm not being helpful, and that's my mission. That was my mission to do this
exactly.
in the first place.
And that's exactly right.
Yeah.
There's a part of you that realizes that, like, we can only do so much.
Right.
and that maybe even what we're doing may not be the best thing.
And especially in that in a system that isn't looking at the whole person,
Right.
that is also money making, not you, but the hospital, right? The system that you're operating in. So that's
Right.
really a dilemma.
Right. And it is very, very conflicting. You have
Sure.
internal conflict because,
Sure.
I mean, we all know, for example, the pharmaceuticals, right? And we see the ads like, yeah, this is good for this, but then you have a risk for death, and
Right.
your arm might fall off,
Right. You
and
can't see.
you might have seizures
Right.
and all of that.
Yeah.
And it's horrifying because
Right.
as a doctor, you're giving this and
Yes.
you're like, okay, all these things could go wrong, and but you're still giving it.
Right.
You
Right.
know, so
I know.
so internally
Yeah.
it's like,
I
oh,
can't imagine.
what
Right.
can you do? How can you feel good about that?
I'm so glad that this is one of your goals in life and missions in life is to help people in your former position,
Yeah.
to help them through navigate this. This
And
is,
just
this is
have
really awful.
some type of support, or
Yeah.
at least talk about it, right?
Yeah.
It's interesting because I've been trying to do podcasts
Mhm.
and talk to other physicians. I just talked to another physician this morning
Yeah.
about this, and one of the things that we would discuss is, oh my gosh, we've really never talked to other physicians about this. There's so many of us out here, but really to have this heart-to-heart
Like
conversation,
feeling this way.
right, about how are we really feeling about what we're doing,
Yeah.
and especially if we're feeling like, yeah, this isn't, it's making you feel bad about yourself, what you're doing. And in fact, tonight I have a session with healthcare professionals,
Yeah.
and it is about finding meaning and purpose in healthcare work,
Yeah.
Yeah.
because once you start disconnecting with your feelings and your body,
Right.
you become numb
Mhm.
and you become burnt out,
Burnout.
and you don't have any meaning and purpose in what you're doing, except you're just doing it on a daily basis,
Yeah.
trying to get through your day.
And then hello depression. Hello
Depression.
alcoholism. Hello drug abuse. Hello relationship down the drain.
Exactly.
Right?
Yeah, and the scary
Yeah.
part is, like I said, this nonprofit organization I'm with,
Yeah.
their main purpose is to try to decrease the rate of suicide
Sure.
and burnout. And I think in the 2020 statistics, they said that out of all of the American physicians, 11% of female physicians were suicidal,
Yeah.
and 9% of the male physicians were suicidal.
That makes
And you
perfect
think,
sense.
all these people, and those are the ones that are suicidal, but what about all the ones who have depression and anxiety
Yeah, right.
that are just going through the
Suffering.
motions?
Yeah.
Suffering.
Yeah, they're suffering and no one's really helping them, and they don't have a platform to really share and get support from other people.
Well, I think a lot of people are waking up. I think as consumers, as patients, I think we're waking up. And I'm so glad we had this time with you to talk about this,
Yes.
because this is a whole new awareness, for me, coming from you, like the experience that you had and what you were struggling with in a system that clearly wasn't supporting you. And how can you support others if you can't support yourself? It's like love thyself first,
Exactly.
right? Because it's the same thing. And then in this beautiful journey that it's taken you on, and how you're turning back to your peers and helping them engage with all the stuff that's not exactly science, but spirit,
Yeah,
and spirit's where it's at. I think that's so awesome.
I agree with you. I think that's truly what's going to change the system. Is if we acknowledge that the spiritual, energetic realms are key
Yep.
for our healing,
Right?
and that we need to incorporate all these other types of modalities in order to address where you're out of alignment.
Yeah.
Absolutely.
Yeah.
So
And get the nervous system back in order and working, and getting the person aware of their own nervous system. Like me,
Yes.
I wasn't aware that I even had 3 parts of my nervous system.
Yeah.
Now I
Right.
know, and now I can regulate my nervous system.
Right.
And if we can teach people that, just that, we can heal.
Exactly.
Yeah.
So that's I was sharing with you some of the things we have at the
Yeah.
retreat center, and because of the way I see things, that's exactly right. Is the basis of a lot of it is regulation of the nervous system.
Yeah.
Okay,
Yeah.
so you have the cold plunge, and it's a form of hermetic therapy.
Mhm.
Is getting your body to the threshold of certain extremes in order to activate its innate mechanisms.
Right.
So the cold plunge is definitely one of them. It
Yeah.
activates the heat shock proteins, activates the immune system.
Yeah.
Also the dopamine system.
Yeah.
Yeah.
We talked about that.
Yeah.
And
Sucks up glucose.
yes, and metabolism,
Mm-hmm.
right?
Yeah.
And so it's lots of benefits, but it has to do with uh, activating our innate own processes,
Yeah.
right? But the
Like
problem,
what's on board.
what's
Like
on board
what we already have.
now,
Yeah.
what we have to consider, why is that? Why have we lost this, right? As a Western society,
Mm.
we're all conditioned to be in this range of being comfortable.
Yes, it's
You know,
comfort.
yes,
It's
everything,
comfort.
the air
Yes.
conditioning, in terms of the extremes of anything, most of us are don't get exposed to that,
No.
right?
No.
So the same thing in terms of physical, but the same thing for emotional,
Yeah.
right?
Same thing.
We're all emotionally stunted. We only feel a certain range of emotions. We don't want things to be too bad or negative. But once you restrict that emotion, you're also not able to fully feel joy and happiness.
Yeah.
That's one of the things I discovered when I started like getting in touch with my
Yeah.
emotions. I was like, gosh, did I ever truly feel like tons of joy and happiness?
Yeah.
Like, really?
Yeah.
Maybe not so much, because I was always trying to restrict the pain,
Right.
like not feeling too much anger. Like that was my childhood. Like
Yeah.
I could never express anger. So I was supposed to be a good person, always taking on everybody's stuff
Yeah.
and not really expressing my
Yeah.
frustration or
Yeah.
anger. But I realized that when I do that, I can never truly feel that, expanding joy
Yeah.
of
It's like the opposite side of the coin,
exactly.
right? You've got to feel both of them.
You've got to feel both of them.
It's this.
Yes.
Yeah.
So
Yeah.
most of us are stunted in this, and
Yeah.
we're sort of operating as zombies.
Yeah.
We're an automatic pilot. We only feel this much, and a lot of people don't feel comfortable being too happy or being too sad.
Yeah. I
Like,
do.
and granted, also what happens is you use things to keep you in that range. For example, alcohol,
Yeah.
right?
Yeah.
For sure.
Yeah, I don't want to feel too anxious. I'm gonna numb myself, so I'm gonna use alcohol.
Yeah.
Or yeah, I don't feel enough excitement. I'm gonna use cocaine.
Right.
Or
Right.
I'm gonna use something to make me feel alive.
Right.
So, but instead, why don't we focus on reactivating, our ability to feel both sides?
Yeah, all the feels, and in cold water, that's what it taught me the most, was to be able to withstand discomfort,
Right.
like for 3 minutes, right? And that was just with cold water. But out of cold water, it enabled me to stand toe to toe with my shadow self, and to be in the discomfort of behaviors or thoughts or beliefs, right? And actions based on those things, and be able to stay with it, learn from it, appreciate it, grow through it, do something else, like pivot, right? Make a change. But with that, the inability to stay there, always glossing over it, always running, always in constant movement or motion, whether physical or mental or whatever, distraction. That was really quite the miracle of cold
Yes.
water for
I,
me.
I really think that is the added benefit is when you're able to physically regulate your nervous system, you're also able to regulate your emotional
Yeah.
aspects.
right?
And I use a lot of the breath work and my experiences in psychedelics.
Yeah.
I mean,
Yep.
that's another all talk.
Well, we're going to have you back for that because that is a passion of ours as well. Because there's so much wisdom in the plant kingdom for us.
Yes.
And it is something that is, I just like to say it's like a leapfrog of advance in human development and knowing thyself and being able to have access to all that we truly are.
Yes. And it is another powerful way to connect science with spirituality.
Absolutely.
It to me, it's like that, the epitome of integration.
Yes.
And there's so much power to it that I think I'm hoping that it becomes a part of our healthcare system in the future.
Well, I will tell you, it's how I broke up with alcohol, using that breath, cold, heat, and some really good counseling.
Yes.
So, and it wasn't a painful process. It was almost instantaneous, and it transformed my life. So I feel like that should be something that should be cutting edge, leading the way, because our world is in so much need of healing.
Yes.
And it's not out there. It's right here. It's right in our own hearts.
It is. And it's as simple and as hard as that.
Yeah.
Is simply the teaching of Jesus and unconditional love and opening up that heart.
Yes.
And if we can all get there, the world would be so much different.
And self-forgiveness, like everything that's happening in the world right now, if it could just all be forgiven and we all realized who we truly were and we were all the same thing, we're all one thing, it would stop. It would stop like that.
Yeah, that was always when I being asked the question of what would be your superpower, and I would say,
wow,
if I had a superpower, it would be to make everybody feel what the other person feels.
Yeah.
Because if you did that, what are you going to do? You're not going to hurt people.
You wouldn't.
You're going to help people.
Right.
And it's going to be service to others, right?
Right.
So I'm hoping that all of this work and the sharing is definitely going to be a part of that we're all going to lead the whole humanity towards that.
I think we are. That's the point, That's what's most likely what happened to you with the stroke and what happened to you with cancer and what happened with me with all my other crazy stuff in my head, right? Like that was the journey. That was the path of how like that we're on now that brought us here. So tell us about your retreat that you've got coming up.
Yeah, we actually have a retreat at the end of the month, and it's a men's retreat.
Awesome.
And I'm excited about it because, as you know, there are not many opportunities for men to be able to come together, support each other, and to learn some of these non-traditional ways of healing.
Yeah.
So we're going to have everything from, cold plunge to meditation to breath work.
Yeah.
And and unique to this one is there's actually going to be 4 physicians as a part of it.
Okay, cool.
So 4 of us, one's a cardiothoracic surgeon, one's an emergency room physician. I do neuro rehab, and we're all sort of sharing our experiences and ways of healing that may not be your standard traditional way. And the beauty about it is it's going to be at a retreat center in nature, and we're going to have an ability to support each other. And really, I'm hoping that this will be a start of a movement of one, allowing men to have the space to be vulnerable and to support each other.
Yeah.
And, and secondly, is to have a space where this convergence of science and spirituality comes together. Because I think that's really what's going to allow more people to become open in terms of their minds and their hearts to a lot of these modalities.
Yeah. Well, awesome. Well, we'll put all the information in our show notes and where we can get in touch with you. And what's the best place for somebody to find you?
Yes, so you can find us at info@goldenhillretreat.com is our email, or it's goldenhillretreat.com is our website.
Okay,
Mm.
awesome. Well, thank you so
Yes,
much.
thank you.
So honor to have you, Nelson, and to be able to call you friend. And I've been to your place twice now, and can't wait to go back because it is really delicious. So
Well, thank you for
yeah,
allowing me to be here, and I'm excited to. I know I'm going to be trying out the different
Yeah,
modalities today.
right
so
on.
So yes, I mean I'm glad that we're in the same tribe and we're
Yeah,
all doing what we can to help people.
all
right
right,
on.
awesome. Thank you so much.
Thank you.